Warm welcome to today's talk. It's a Wednesday the 9th of February and the sun's just come out, which is quite nice. Now, I've had a lot of concerned emails and letters about this article here relating to ivermectin. And this is from MedPage Today. Obviously, I'll give you the reference. Ivermectin arm of principal trial put on hold. Now, if you haven't got time to watch this whole video, the answer is it hasn't. Ivermectin is still in the trial. So ivermectin is still part of the principal trial. And it's a rather curious story what's happened here. So let's have a look at it. Before we do that, just a bit of background. So the principal trial, and we're looking at ivermectin particularly. Now, MedPage Today hopefully gives some useful information from Merck, the manufacturers of ivermectin, or one of the original manufacturer anyway. It's made all over the place now in India and things. Anyway, Merck helpfully tell us that they've concluded that the probability of ivermectin providing a potentially safe and efficacious treatment option to SARS coronavirus 2 is low. So Merck, the manufacturers, don't seem very optimistic about the potential for ivermectin. As a result, they say this, and have prioritised internal efforts towards the development of alternative candidates that provide a higher probability of success for the treatment of COVID-19. Now, just nothing to do with this, of course, but ivermectin is off patent now. You can't make very much money out of it. It's off license, so anyone can make it. New drugs, of course, typically would have a patent of 15 years. But anyway, let's carry on with this helpful statement from Merck. If clinical data emerge providing definitive evidence for a positive benefit risk assessment of the use of ivermectin in COVID-19, we stand ready to provide our expertise and resources as needed. So just a bit of helpful background. Now, of course, this is the ivermectin trial, part of the principal trial from a certain university in England called Oxford University. Now, let's just look at where this came from and try and work out what's going on. So this was the MedPage Today article, and this actually goes back to the 14th of December. Ivermectin arm of the principal study put on hold. Trial website cites supply issues. Now, let's just see how probable that would be. Now, this is Professor Chris Butler, who's the head of the principal trial, based in Oxford. From the University of Oxford's Nuffield Department of Primary Care Health Science, Joint Chief Investigator. Now, this is from the site. He says ivermectin is readily available globally, so how could there possibly be any supply issue with it? It just doesn't make any sense. I mean, here's my personal supply that I got from suppliers. Well, this is Indian ivermectin. I keep this purely for educational, illustrative purposes, of course. But it's there, it's readily available. It costs literally pennies, a few cents, it's literally, but I think I worked it out once. The World Health Organization are paying about 4 cents a tablet. It's essentially free, and can be produced in huge scales. As I say, this prop here that I keep, I suppose it would be useful if I did get strongylides or onchocerciasis, which is what it's prescribed for at the moment, agreed by the World Health Organization. But it's readily available anyway. That's the point I'm making. And Chris Butler, of course, says this. Ivermectin is readily available globally, so there is not a supply issue with it. Has been in wide use, again, Chris Butler speaking, on the website. This is directly from the website. It's been in wide use for many other infectious conditions. It's a well-known medicine with a good safety profile. Remarkably good safety profile, actually. Very good safety profile. Obviously, we never prescribe on this channel, only take drugs prescribed by our own healthcare provider. And because of the early promising results in some studies, it's already being widely used to treat COVID-19 in several countries. So that was sort of Chris Butler's background statement there. Now, if we go back to this here, so this was the concern. And now it says here, ivermectin trial in the UK principal trial is currently paused due to temporary supply issues, according to the trial website. Now, I'm somewhat mystified by this, unless it's changed or something, because you click on the website there, and that's just a direct click link that we've done, and we find no talk of it here on the site. This is the principal trial website. Help finding treatments for COVID-19 from home, which of course is exactly what we want to do. Avoid hospitalisations if at all possible. Very laudable principle. Principle is a UK-wide clinical study from the University of Oxford to find COVID-19 treatments for recovery at home. And it's 9,000 participants have been recruited so far. This video here just gives you some, I'm not going to play it, just gives you some useful background information on the trial itself, who can join, eligibility criteria, and then drugs that are being looked at here. So we've got for Vipavir, antiviral drug, and we've got Ivermectin, which are currently being studied. Now, have we missed something here from the news? So let's go on to the news from the principal trial. And here we have the feature of a great success of this trial. Here they discovered that asthma drug budesonide is useful. Inhaled budesonide, a common corticosteroid, is the first widely available inexpensive drug found to shorten recovery times in COVID-19 patients aged over 50 who are treated at home and in other community settings. Report to the principal trial in 1,779 participants. The drug is now available to treat COVID-19 on a case-by-case basis in the United Kingdom primary care. So that was good. But then we look on and we see, well, is there any news about Ivermectin? So, well, here's their bit on Ivermectin, but this bit actually hasn't been updated since the 23rd of June. So again, we can click on that. And we see that Ivermectin to be investigated for adults 18 plus as a possible treatment for COVID-19 in the principal trial, and no change. So it seems to be still ongoing that Ivermectin is being investigated by the Oxford principal trial. And again, we see nothing here of supply issues, no issue at all. Now, At the start of this talk, I said it's still in the trial, and the reason I know that is Chris Butler was kind enough to tell me that yesterday. I'm not going to say more in the email. I haven't got permission to release it, but he did tell me Ivermectin is still in the trial. So where this has come from, I really don't know. Also, if we look at the registry of clinical trials here, we see principal clinical trial evaluation treatments for suspected and confirmed COVID-19 for recovery at home, and that is all the information there about the trial where it is registered. So interesting where this story's come from and what it means. So that's the registry, International Standard Randomised Controlled Trial Number is what that stands for. Right, so and they say here, this is a direct quote from their site, overall trial status ongoing, recruitment status recruiting. It's just completely unambiguous. When is the study starting and how long is it expected to run for? Well, again, this is on the official registry of the clinical trial, March 2020 to September 2022. Now, disappointing that the results are going to take so long to come. And currently we're investigating these two drugs, for Vipavir and Ivermectin. They're the two drugs currently being investigated by this trial at the moment. Now, if you put for Vipavir into the British National Formulary site, it doesn't actually come up, because it's not really being used. I believe it's being used for certain types of influenza in Japan. But here we have the description of the influenza and the medicines that are being used, and we actually see that for Vipavir is not actually being used in the United Kingdom at the moment, but plenty of other interesting things on influenza there. But it is being prescribed in Japan for certain criteria for people with influenza. The other drug here we see is part of the British National Formulary. British National Formulary, of course, is the definitive authority, really, for any drugs in the UK. So here's the Ivermectin, recognised, approved drug by the British National Formulary for this rosacea condition with redness, strongyloides, which is the worm infection, and onchocerciasis, which is the one that causes the swelling of the lymph nodes, and scabies. So there you go. With oral use, ivermectin is unlicensed, but the drug itself is on there for British national formulary. So if I were to get strongylides or onchocercitis, I've got some handy, I suppose. Even though mine's only for educational purposes, I think it's still in date. So, a bit curious, really. So now, quite a lot of pressure's been put on Professor Butler by various groupings to release data early. But of course, this is a randomised, double-blind controlled trial. So Professor Butler himself, as the trial organiser, doesn't know who's getting what drug. That's the whole point. He doesn't know, so it can't influence the way he influences patients, and so it can't influence the way he interprets the data. So it's a double-blind trial. Independent data. There's an independent data monitoring and safety committee as part of the trial. So that's, again, normal, good practice. We'll pick up any signal for futility, superiority or safety. Again, makes perfect sense. We'll let the trial steering committee know, which Professor Butler's on the trial steering committee, I understand, so they'll let them know. And then a final analysis can be conducted following the release of results and data. So this shouldn't be any later than September. Now, frustratingly slow, of course. But strange that this story's come about saying that there were supply issues with a drug which patently there is no supply issues for. It's readily available. So there you go. It is ongoing. I think this just illustrates a lot of the emotion that surrounds ivermectin. And of course we have to go by the science, which we have done several times on this channel. So there you go. We look forward with great interest to the results of ivermectin for home treatment, because it's cheap and readily available and has an excellent safety profile compared to many other medications. We look forward to that, and the trial is ongoing. So looks like we've nothing to worry about. Readily available, no supply issues, part of the British National Formulary. So quite why this, well, quite where this came from is somewhat of a mystery. So not saying anyone's right, not saying anyone's wrong, just saying it's a bit strange. But a lot of you have written to me concerned, so hopefully that puts everyone's mind at rest that the ivermectin trial is ongoing under the auspices of Oxford University in the principal trial. I think we'll leave it there. Other things to say today, but we'll just leave that there because it's quite an important message to get out, and thank you for watching.